Now that you've had time to settle into the community, what are your perspectives on the dynamics of the Space Coast medical community?
Well, I think it's a great place to practice medicine. Being a physician, this is I can see how any doc would want to practice here. Everything is available in terms of the specialty care, in terms of good primary care, well organized organizations, hospital care, skilled nursing facilities. It really is a tightly knit community. Uh, it gives an opportunity here that maybe isn't available in all places for docs who are independent to work independently, or docs who want to work for a larger organization to work with a larger organization. That isn't always available. I think the only thing that is not available in a full service form would be a medical school. But many of the docs in the community serve as preceptors for a number of the medical schools and the like around. So from that standpoint, you're getting that influx of fresh, new physicians, fresh new kids who are interested in medicine, and that just makes your community grow, really.
Dr. Jones, experts say that accountable care organizations are more effective and efficient when organized and operated by physicians. MPAC is still, as far as I know anyway, the only ACO on the Space Coast.
That's correct. We're the only accountable care organization here on the Space Coast.
Why physicians rather than the hospital organizations?
Well, this accountable care organizations are really about primary care. I mean, it really is more of a primary care organization than a specialty organization when you really look at it. Because what the feds want to, the federal government wants to accomplish is to try to get the patient back in the hands of their primary care doc. We've used the term gatekeeper or my primary care physician, or the one that really controls the traffic for that patient to the specialists and the like. But you need at least one person who is looking at everything. Many times patients are, let's say, seen by a cardiologist who do a tremendous job of taking care of the patient around cardiac issues, but may miss other little smaller issues that they aren't tuned into. And so you can't be the primary care guy for being able to be that traffic negotiator, that one that looks after your preventive care issues. Making sure that you got your pneumonia vaccine, your flu vaccine. All those kind of things are very important. Those are the things that keep you out of the hospital and keep you healthy.
Yeah. What about in terms of physicians being able to coordinate the care with the other available resources in the community? It seems to me, having practiced for 20 years in this community, that doctors really have a better handle on what a lot of those resources are within the community than some of the bigger corporate organizations.
I think that doctors get used to using several different kind of resources, whether it's a particular skilled nursing facility or particular urgent care facility or particular specialists and the like. And what we try to do as accountable care organization to bring all of those facilities, all of those opportunities for patients to get care, be it at a hospital, a non-hospital, whatever sort of setting, we try to determine, help that doc determine. And when physicians don't quite know where they'd like to send somebody, we have those alternatives for them.
Right. You've got that baked into your accountable care organization. You know where to go and how to help them out.
Correctly. We let them know that, listen, actually we've put together a map that has a dot for every doc's office throughout the county.
Right.
And then we've overlaid a plastic overlay, which is every skilled nursing facility, every urgent care center, every hospital. So we can actually show the physician exactly where these things are in relationship to their practices. You know, we have 33 quality measures that we use within the ACO, and many of them around diabetes, high blood pressure, simple things like falls and depression screening, so on and so forth. And to be able to use standardized standards in independent practices gives that doc, and we think it's an overflow, because if they learn how to do that with their Medicare recipients, all of a sudden you start doing it with everybody. It just becomes, it becomes a very easy. And we can look at our statistics, and we have looked at our statistics, and we can compare 2012 with 2013, and now we're into 2014, and we can see those statistics just going up, up, up as it relates to how well they're doing with depression screenings and falls assessments and blood pressure control, and many of the 33 parameters that we use to look at individuals with. And so even though we have individuals that are in other programs that are not part of the ACO, we encourage the docs to do the same sort of thing for them as well.
Yeah. Obviously, it wouldn't be an interview without this question, but as you look to the future, how do you think, and as the major provisions in the Affordable Care Act start to kick in, how do you think, what kind of an impact is that going to have on BPN as an independent physician association, and on MPAC as an accountable care organization?
Well, you know, one of the things is medicine is a constant change, you know, and I made the comment that when I finished my residency program a number of years ago, I was really one of the smartest residents you ever want to run into, and we were talking at that time about HMOs, and I said, these HMOs, they'll come and go, and I'll just be finishing up my practice. Well, HMOs and ACOs and MSOs and all kinds of things have come and gone, and we're constantly morphing. So BPN will have, and MPAC will have to figure out where their niche is in this new healthcare system, and how they survive in it. And so it's going to be a change. Whatever we do today, next year or 2 years from now, we won't be doing, or we'll be improved on it, or it will be doing it in another fashion.